Hi everybody, welcome back to my channel. This is Sagnick. I'm an MBBS student at Burdwan Medical College and Hospital, West Bengal. In this video, I'll be talking about something called as clinical postings. Now, clinical postings are basically nothing but your ward visits in your second year of MBBS, where you actually get to see the actual patients and get to know about their treatment plan, how to diagnose those patients, how to clinically examine different kinds of patients. So what actually happens is, in your second year of MBBS, you are given a complete routine and you are posted into different departments and different wards, basically gynae, medicine, pediatrics, surgery, and you get to see different cases. Now, why is clinical postings important is because it actually gives you the early clinical exposure to different kinds of cases, and you get to know and understand about the different cases, how to handle them, how to examine them, and that is why clinical postings become very important in your second year of MBBS. So in this video, we'll be talking about what are the things that we need to do in our clinical postings, how to efficiently use our clinical postings, and what are the different resources that we should use in our clinical postings. So without much ado, let us start this video. Before starting the video, I would like to request all of you to hit the like button, subscribe to the channel, because it takes a lot of time, effort and energy to actually create all these videos. So if you really like them, consider subscribing to the channel. Now, talking about clinical postings, the very first thing that we need to know is something called as history taking. History taking is basically the baseline and the crux of something called as medicine. It is here where we actually talk to the patient and get to know the slow progression of the disease, what are the early symptoms, what are the late symptoms, what were the basic clinical manifestations. So basically we get to know and understand everything that we read in our books for a particular disease, what were the presenting symptoms for these kinds of patients. Now, why is history taking important? Because history taking actually helps us to get a chronological sequence of every event, where we get to understand the sequence of events which followed until this severe case of the disease has occurred, which actually helps us to understand the ultimate cause of the disease, what should be our diagnostic and treatment plan further on. So at this point of time, what we actually need to know in our history taking is four different important things. Is number one, the chief complaints of the patients; number two, the history of the present illness; number three, the history of past illness; and number four is the treatment history of the patient. Now, what do we do in all four of these things? In chief complaints, the first one, we actually get to understand the presenting complaints of the patient. Once the patient comes to you, when you are a doctor in the OPD or maybe in the emergency, what are the clinical manifestations and what are the actual complaints of the patients? We write the complaints of the patients under this chief complaint section in the patient's wards itself. For example, if I just take a case of meningitis, this patient came to you in the emergency and presented that she was having breathlessness for the past 4 days, she was having cough and fever for the past 7 days, and at the same time, when she was coming to the emergency, she was in a state of altered sensorium, and that was for the past 1 day. Now, once we have actually known about the chief complaints of the patients, we talk to the patient about the chronological sequence of events that has occurred to this patient. Now, once talking to this patient gives a history of this disease, that for the past 7 days she was suffering from fever and cough. She went to a local doctor in a public health center, where the doctor prescribed her paracetamol and amoxicillin. After 2 to 3 days, when she was having consistent fever, she went back to the doctor and the doctor changed the medicine to norfloxacin, after which the fever subsided. Once the fever subsided, she went to a local village pond to take some bath. After coming back from the bath after a few years, she started having severe dyspnea, and after a few more hours, she started to be getting into a state of altered sensorium. Now, with this we come to the end of history of present illness. In the history of present illness, we got one significant point that she went for a bath in a local village pond, which basically at times is not so clean enough. So it might be that the bacteria might have entered into this person while bathing in the local pond. And that is why history of present illness becomes very important, so that we can get to know and understand the cause of the disease that she was basically suffering from. Then we get to know the history of the past illness. In the history of the past illness, we get to try to understand the different kinds of comorbidities or the different other diseases that she might be suffering from earlier. So in this case, the patient was suffering from diabetes and asthma for the past 10 years. Now, after this history of present illness, we try to get to know and understand something called as the treatment history. In the treatment history, we get to know the different kinds of drugs and medications that she might be on at this point of time. Now, why do we need to know about the treatment history? Because once we get to know about the different kinds of medications and drugs she might be on, we would carry out our further treatment. For every drug, we cannot administer some other drug, because different drugs has different kinds of drug-drug interactions within them, which might result in some bad consequences. So we need to know and understand what are the different drugs that she was already having and what are the different drugs that she might be administered. In this case, because she was a patient of diabetes and asthma, she was on two drugs, that is metformin and salbutamol. Thus, history taking becomes very important in understanding the sequence of events for the disease, and these shall actually eventually direct our ways of treatment for the particular patient. Now, for history taking, what is the ideal book to have is this book called as Bedside Clinics by Dr. Arup Kundu sir. This book is an absolute gem where we actually get all these kinds of common cases that we see in our regular wards, and they are given in the form of these clinical history type of thing, where we get to actually understand what are the different things that we need to ask that for that particular patient. So once you get to understand the different sequence of events that might be asked and that should be asked following this book, you get a hands-on advantage over your peers while understanding taking up history for the patient. Now, after we have actually completed this called as history taking, we need to know something called as clinical examination that we do in our clinical postings as well. Clinical examinations are basically the examination of certain clinical manifestations of the patient for the confirmation of the particular disease that the patient might be diagnosed with. Now, if you see this video that you might be seeing on the screen, here our resident senior, she is trying to help us understand how to palpate the liver for a liver cirrhosis patient. But while we were actually palpating in this patient, we could not actually find and palpate the liver. And that is when she said we cannot actually palpate the liver because this is a case of severe liver ascites, and because the liver has turned into a cirrhotic stage, the liver has actually shrunk, and that is why we could not actually palpate the liver in this case. So it becomes very interesting to actually understand where we can actually turn out to understand the different kinds of clinical manifestations for different kinds of diseases. So clinical examinations become very useful. Not only palpation, but we have different other clinical examinations like auscultation, what we do using our stethoscope. The same stethoscope that you were actually using in your physiology classes to check on your friend's heartbeat, we shall use the same mechanisms to actually now listen to an abnormal heart sound in an abnormal patient. And that is when and where you should actually get to differentiate between a normal heart sound and an abnormal heart sound, and actually find the significance of those 2 to 3 heart sounds that we usually listen. And that what makes these clinical examinations very important for you as a medical student. Now, after we have talked about something called as clinical examinations, we do something called as clinical procedures. So clinical procedures are basically nothing but the different kinds of techniques that we use to do certain examinations and tests on the patient. For example, drawing of a blood, for example, catheterization, for example, lumbar puncture. All these things are something very important to know and understand. In most of the government hospitals, because the government hospitals are too busy to handle different kinds of patients, and the resident doctors are also very busy, while in our second year of MBBS, when we do not actually have much of expertise of doing all these things, we are not usually allowed to draw the blood, or we do not usually catheterize the patients, or maybe we are not even trained to do something called as lumbar puncture needle, which requires too much of accuracy. But at the same time, when we actually shadow our doctors, our resident seniors, or our interns, we get to know and understand all of these. In your second year of MBBS, if you are not allowed to do these kinds of things, do not get upset, because eventually in your internship you will be doing all these same things, and in the internship period we will be doing all these so regularly that you would get frustrated. So at this point of time, it's better to actually keep yourself away and try to observe the things which the seniors are doing. At times they do mistakes as well, but you can learn from their mistake. Now there's always an alternative. If your seniors are cool enough, if they have time, if from your regular class timings, if you go from a cold time, you can always learn all these kinds of things by requesting your seniors, and they would be more than happy to actually help you out with this. Now these clinical examination procedures are great things of examinations of the patients, and we need to actually understand the basic importance of these. For example, if you can see in this video of the patient where she is done with lumbar puncture, where basically the CSF is collected. So basically from this we can understand that this patient might be a case of meningitis where the CSF needs to be examined. Similarly, for the patient of this liver cirrhosis and ascites, we might get to see a clinical procedure of fluid aspiration. So all these clinical procedures vary from person to person, and these clinical procedures at the end of the day becomes very important to understand the different diagnostic features of the particular patient. Now, once we have known about history taking, clinical examinations, clinical procedures, there is another thing which we can actually understand and get to know in our clinical postings, and that is our knowledge about drugs and different kinds of instruments. Whatever drugs and instruments that we study in our books, we can see the practical applications of those drugs and instruments in the clinics, and that is very important, because what are the different doses of certain particular drugs, what are the different ways of administering the drugs, and how are they administered, what are the different kinds of complications that might occur in case of those drugs, and what are the different instruments used for different procedures. We can practically see and understand the utility of every bit of that during our clinical postings, and that is very important. Now, once we have talked about the different kinds of things that you need to do in your clinical postings, starting from the taking up history to clinical examinations and clinical procedures, I would like to share some important clinical cases that I got to see in my second year of clinical postings. So when I actually started with my clinical postings for the very first time, I was posted in a department called as Psychiatry. Now once you go to your Psychiatry department, you would actually find that this is one particular department where there is no particular symptoms which a patient might present to you with. There will be lack of communication, there will be lack of proper presentations of the illnesses, because once these patients come to the department of Psychiatry, most of them are in a case of altered mental state. And once you actually get to know of the history of the different things of these patients from their family members or from their peers, friends, then you would actually get to know and understand something called as mental health. Mental health becomes very important, and it is so important that it might even cause you to end your life. So there was this one specific case which I remember till date, was a case of schizophrenia, where there was this patient of around 22 to 23 years of age. he was administered in our hospital and he was taken up for gradual communications and mental counselings in our hospital. And what we got to know from his history was this boy was in love with some girl some 5 to 6 years back, and she for some reason betrayed him, and at the end of the day he started hallucinating and started having delusions, for which he tried to die by suicide, and that was something very disastrous. So he was taken to our hospital. He went through severe mental counselings and was under certain medications as well, and later he was discharged safely. But while taking up the case of this patient, something which actually came into my mind was how important mental health is. We need to talk about something which is causing some mental disturbance in us. For this patient in particular, if he would have spoken about all his grief and grievances to his near and dear ones, his families and friends, and if they would have been supportive enough to talk to him, talk about all his miseries, then he might not have been in this state. Psychiatry is one such department which do not need much of invasive investigations but can be solved more by talking and understanding the particular disease. So it is one such department where history taking is very important to know and understand. The next department that I was posted at was medicine. Medicine is a beautiful department where you can see variety of cases. While my clinical posting was in the medicine ward, I got to see different kinds of patients, starting from liver cirrhosis to meningitis to acute myocardial infarction to snake bite to poisoning as well. So medicine gives you a variety of insights to different kinds of patients. But there was one particular case where there was this patient called around 24 years of age who died just because of his reckless drinking habit. He was diagnosed with liver cirrhosis, which ultimately led to something called as the hepatic encephalopathy. He was completely out of his control with altered sensoriums. He was not even having a proper urine output. All his vitals were disturbed, and just after 3 days of his admission into the hospital and being in these artificial supports, he passed away. And 24-25 years of age is not when you actually pass away just because of these reckless habits of yours. We as students, when we actually get out of the comfort of our home, we get to have a social exposure. We tend to move towards these things of addictions like cigarette smoking to alcohol drinking. But at the end of the day, all these things cause harm to ourselves and might cost us in losing our lives as well. So it is very important that we stay in a completely self-controlled environment where we refrain from doing all these negative things in the society. So these were two of the most important cases which I got to see in my clinical postings. Apart from that, I got to see some cute babies and their problems in the pediatrics department. I was even posted in the gynae department where I actually got to see a natural delivery of a baby. And that was so fascinating to see this new life coming onto the earth and how the mother actually goes through so much pain to actually see this happiness and listen to those crying sounds of the baby. And that was so fascinating to listen and understand in our gynecological postings. Now with this, we come to an end of the discussion of this something called as the clinical postings, the different things that you should do and the different things that you should not do, and the different learnings that you can have from these postings. Now one last thing which I need to talk about is most of our seniors and many other people in and around us usually suggest us that we should not go for these clinical postings because you do not get to see many of the things, because there are not many people interested in teaching you, because most of the resident doctors are busy seeing and watching their patients, so it becomes very difficult for them to make you understand and take out some time for you to see these patients. But at the same time, I feel that it is very important that even if someone else is not teaching you something, you go and take up history from these patients, because it actually helps you to understand the progression of a disease. What are the different clinical manifestations of the disease? So once you actually study these in the books, you get to understand the actual presentation of the disease and what are the different things that you see and read about in the books, and you can relate them together and have a better understanding of those particular diseases. And why is it very important in second year of MBBS to go for those clinical postings is, in the second year of MBBS, you have two added benefits. First is your knowledge about anatomy, physiology and biochemistry is fresh enough. You have just passed your first year of MBBS and now come to the second year of MBBS. And added to that, in the second year of MBBS, you study something called as pathology, which turns out to be the basic of the subject of medicine, where you actually get to see and understand the pathologic conditions of these particular patients. So relating the normal physiology along with the pathology and seeing the exact manifestations in the patients helps you to understand the basic criterias and basic manifestations of particular diseases, and that is what makes you a better doctor at the end of the day. It helps you relate and resonate better about these cases in particular. So I hope you like this video. If you do, hit the like button, subscribe to the channel and share this video with your friends and your peers who might find it helpful. Thank you.